Alright, you're live.
Hey guys, this is Danielle again at Dr. Emer's office. We are going to be using Morpheus8 for our patient who has some acne scarring. So we have been improving this over time using the RF microneedling, and we're on probably treatment number 4. 3. So we're on treatment 3. It's going great. Every time he's impressed by how good the results are and of course how short the downtime is. So I want to show you what the device looks like. It's a full compact unit right here. And this is actually a multi-platform device, so it also has IPL in it and it has some skin tightening. But what I want to show you is that the depth on this Morpheus8 treatment is variable. So I can actually change this from body to face to periorbital. And so with that, I use this more shallow setting on any areas that don't have a lot of fat or tissue underneath, things like the forehead, around the eyes, near the elbows when we're doing body treatments. And I can adjust for each patient's individual area. So that's a very unique feature with the Morpheus8. So we're going to start on periorbital for the forehead. And for energy, we're going to crank this all the way up. We're going to do energy 30. Now, the other thing about the Morpheus treatment, this is the hand piece. What I want to show you is that you can have these needles fixed. Here we go. Fixed to where they stay out as they continue to deliver energy. Or we can cycle it so that it gets automatically repeated. So that's another feature, and this is really great for consistency with your treatment. So we're ready to go. We have everything set the way we want it to be. We're going to move over here and start on the forehead. So as you can see, this is a thinner area of the body. I'm going to take this off for 1 second. Turn your hips to the side. What you see here are a little bit of some indentations, little lines in the skin. These are all things that Morpheus8 or RF microneedling are going to improve. So fine lines, pore size, just overall texture. And when it comes to acne scarring, skin tightening oftentimes makes scars look a lot better. So we're going to give you your ice pack back. Go ahead and pull that side. We're going to start right up here. First one. So as we're moving along the skin, we're pushing these needles about 3 millimeters in depth. You can see some pinpoint bleeding, but that's about all of it. As we move through, feel okay? As we move through the area, you'll see the pink start to develop. It's a good sign. Do you want to tell us what this feels like? Can you describe it?
For 1 second it hurts and then it goes away.
It is like a little prick. You can feel some of that energy kind of coming into the skin, and we can push this energy quite deep. So the RF is great for skin tightening, and it's great for anti-aging, but it can be a little bit uncomfortable. So with this treatment, we do topical numbing, and that's typically enough. We can also do nerve blocks, and this is something that we combine with other treatments quite frequently. So we'll use whatever measures are needed for that. But the reason that we can combine this treatment with so many other lasers is because the energy is targeting a deeper depth of the skin when we combine this with something like Clear and Brilliant, which is a nice resurfacing treatment, great for tone, texture, and pores, as well as pigmentation. This treatment focuses deep. Clear and Brilliant focuses a little bit more superficial, and you're really able to target the whole depth. So you're getting a lot of enhancement out of one single treatment. So I always said up top, the forehead is the most uncomfortable, and then we'll move down to the cheeks. And at that point, we can also adjust our depth to be a little bit deeper in the skin. Doing okay?
Yes, ma'am.
So you can see here, I've had some pink develop. And there's just one little outline of some missed spots, so I'm going to go back here. Good. Continue our way across. So I'm double pulsing all of my deliveries of energy. So each time that this is in contact with the skin, he's getting 2 doses of energy, which is like doing multiple passes, but in one. So it's much more comfortable. You get a lot more out of it without having to sit through the entire treatment twice. So we like that.
And it's dramatically less painful than Fractora or other treatments.
Yeah, so the difference between Morpheus and Fractora, and I do love both. I've been a believer in Fractora since the very beginning, but Fractora was the predecessor to this treatment. And the differences between the two is that this one, the needles come out as I press on the foot pedal. And with Fractora, so you can see that there, with Fractora, we are responsible for pushing the needles into the skin. So this is a little bit newer of a technology. I'm going to take this. You go ahead and turn your head to the side. Perfect. This is a little bit newer technology, and it's a little bit more comfortable. Energy-wise, we can both get a good, strong treatment, but the fluidity of this makes it pretty tolerable. So I'm just going to finish treating around the eyes. Now, he came in looking to target his acne scarring, but you've had a double benefit out of this. And how many people in your family are jealous of you now?
All of them.
So there's been, in a very short time period, quite a dramatic enhancement of your overall skin. Can you tell them, I know this is uncomfortable, but can you tell them a little bit about what the time frame was like between downtime, results, and how all of that kind of kicked in?
The downtime is a day, maybe 2 days, and you start seeing results within about a week. And the story that I tell is that I hadn't seen my sister in about 6 weeks, and she knew that I was losing weight. When I went to visit her, and the first thing she says to me is that she thought I had lost more weight. Because my skin was tighter. And I haven't lost any more weight.
Yeah, no, it does set in very quickly. I would say that you're really only maybe a little bit pink for one day. Like the next day you have some very, very pinpoint little baby scabs, which on a man's face with all the hair follicles, you can really hide them quite easily. But even for a woman, it's not very noticeable, so the downtime is quite minimal. And in about a week, you're well healed and just kind of glowy. And by 3 weeks, your skin has really remodeled quite nicely, and it's looking much tighter, much smoother. Myself included, but I have patients, even my patient earlier today was saying how she doesn't really wear makeup anymore on her forehead. It's so much smoother. She doesn't have all this textural irregularity and uneven tone. So it's been very helpful despite, the differences in what we are trying to treat. So there's a number of concerns and conditions that Fractora or Morpheus8 are very helpful in remedying. And we've had a lot of benefit here.
You said on the forehead it goes 3 millimeters deep. When you start to do like the other parts of the face, like the cheek, how deep does it go in?
So that's a good question. So when you adjust to the more shallow depth, you're between 1.5 and 3. 3 is the standard. When you adjust to the body depth, what you're getting is a thermal effect up to 4 millimeters, and that is at the junction where your dermis and your adipose layer meet. So what you get with that, I'm going to turn you all the way to the other side. I'm going to take this one. So what you get when you're targeting that deeper layer is you're smoothing and remodeling that junction. So you get a lot of tightening there, but you also, you're smoothing out the fat layer as well. So you're minimizing any ripples in the skin on the body, like on the banana roll, the back of the thighs, knees, thigh, front of the thighs, any of those. You're getting not just the tightening in the skin itself, but the fat. And again, that's at that 4 millimeter depth, but this is a sub-adipose remodeling device. So you're also getting that fat layer thermal effect. Doing okay? So right now we're on the face setting. We're getting a lot of good treatment here. So So now as far as aftercare goes, you're pretty good with your skincare regimen, aren't you? We incorporate a lot of growth factors because of their healing properties, stem cells, cytokines, all of these components that will repair damaged cells, cell walls, give it the hydration and essentially the nutrition that your skin needs to rebuild itself and heal itself as quickly as possible. Depending on your skin type, you may incorporate some brighteners, but on that note, this is a treatment which is safe for all skin types. So it makes it a very good treatment for darker skin types who have acne scars or need tightening, because in the past that was much harder to target. So we get a lot of benefit now. There you go. So I'm going to finish up on the face. I will tune back in a minute to show you the neck treatment. And if you have any questions, we'll adjust them at